Hi, Dr. Joe Dell'Orfano here at secondopinion.com. So you've been diagnosed with atrial fibrillation, and I want to explain to you what that means. Normally, the heart's conduction starts at the upper right-hand side of the heart in a group of cells known as the sinus node. The sinus node, think of it as your heart's battery or your pacemaker. The heart is basically made up of muscles, and they don't contract unless they get an electrical signal. Well, that electrical signal comes from the sinus node. Once the electricity runs out of the sinus node and activates the top chambers, it's picked up by another group of cells called the AV node and sent down to the left and right ventricles, which are the main pumps of your heart. This happens every heartbeat, and this is the normal conduction of the heart. With atrial fibrillation, the sinus node is no longer functioning. There are short circuits happening throughout the two top chambers, or the atria. And these short circuits cause the atria almost to, instead of contracting normally, they kind of wiggle and fibrillate. So the blood isn't getting pumped efficiently through the two top chambers. Electrically, in the top chambers, you have a chaotic rhythm, and that gets passed on to the main ventricles, sometimes in a rapid and irregular fashion. So when somebody has atrial fibrillation, they end up with a very irregular heartbeat. Sometimes it's rapid, sometimes it's slow, sometimes it can even be normal, but it's almost always irregular. The problem with atrial fibrillation is that it can cause three things. Number one, it can race your heart, and if the heart races for too long, for too fast, that can weaken the heart muscle. This can lead to something called congestive heart failure. Now the good news is that that can get better once the heart's rate is controlled. The second thing, and probably the most dangerous thing, is atrial fibrillation can cause a stroke. Remember I told you the top chambers aren't squeezing properly? Well, that means the blood is not flowing properly through the top chambers. Whenever blood doesn't flow properly, it can form blood clots. Now, if a blood clot forms inside your heart, it can get ejected out of the heart, and the first stop after the heart is the brain. And so the blood clot goes to the brain and can cause a stroke. Unfortunately, strokes are often not reversible, but there's a good treatment for this, or preventative treatment for this, and that's a blood thinner. There are several different types of blood thinners, and that'll be the subject of a different video. So basically we need to treat people to prevent their heart from racing, and also to prevent the blood from clotting and forming a stroke. The third thing that atrial fibrillation can cause are symptoms, and that's the most distressing thing to many people, because that's the palpitations you feel, the shortness of breath you feel when you exert yourself or walk, the racing heartbeat, all sorts of different symptoms. Now, some people don't have any symptoms at all, and that's difficult to treat because we don't know when they're in an AFib, and we don't know when the heart's racing. But most people have some symptoms. So the goals of treatment for atrial fibrillation, number one, to keep the heart from racing, and number two, to prevent a stroke. But number three, and perhaps most important to you, is to prevent the symptoms that you're experiencing. Now, we can often prevent symptoms by simply slowing the heart rate, keeping it from racing. But sometimes we have to put the heart back into normal rhythm. When we do that, we almost always have to use a medication to hold the heart in normal rhythm. We're not always successful at doing that. Most of our medications are about 60 or 70% effective at controlling the heart's rhythm. Sometimes we have to use an electrical cardioversion, which is a procedure that where we deliver an electric shock to your chest, and that converts the rhythm back to normal rhythm. But once you're in normal rhythm, we need a medication to keep it in normal rhythm. In addition to medications, we often will use a technique called ablation. Now, ablations for atrial fibrillation, again, they don't cure the atrial fibrillation, but they can help to treat it. And they're approximately 70% effective as well. However, between using ablations and medications, we often can find a really good treatment for atrial fibrillation, one that can prevent you from having the symptoms and the recurrences that you are experiencing and that cause problems with the atrial fibrillation.